I would say it was a good journey. We had a good support from Dr. Rahul, Dr. Updesh, and the entire nursing staff as well. Shiva is she's like Dadi of these kids.
Many congratulations.
We were very new in Gurgaon. हम लोग नए नए गुड़गांव में शिफ्ट हुए थे एंड वी वर एक्सपेक्टिंग आवर फर्स्ट बेबी. तो हम लोगों ने दो चार लोगों से पूछा विच वर ऑलरेडी इन दी डॉक्टर प्रोफेशन. उनमें से एक डॉक्टर थी, मेरे सिस्टर हैं डॉक्टर, उनकी एक फ्रेंड थी जिन्होंने डॉक्टर रेनू के बारे में सजेस्ट करा. हम लोगों ने बाकी और किसी जगह पे नहीं गए. वी वेंट स्ट्रेट टू ओल्ड आरवी विच इज़ इन सिविल लाइन्स. We met the doctor and we were very happy and confident, and we started our treatment there with the Dr. Renu. So that time the process was very easy, nice. Even it was a normal pregnancy and there were not much complications, and we had a good support from the Dr. Renu as well. So all went well and it was a very good experience. और हमारी जो फर्स्ट बेटी थी निम्रत, शी इज़ 4+ now, वो हमारे वहाँ पे उसने बर्थ लिया. So उसके बाद से there was a gap of 4 years, and then we were planning to have another baby, and we already have a place in our mind where to go. We already knew which doctor to go, and we were at village due to the corona time, and हमने वहाँ पे किसी को चेकअप नहीं करवाया. We only came to Gurgaon and we came straight to Aarvy, and it was very good for us also because लास्ट टाइम हमें बहुत ट्रैवल करना पड़ता था आरवी के लिए, बट इट वाज वेरी क्लोज टू अस. सो दैट वाज वेरी वेरी गुड न्यूज़ टू अस एंड वी वर रियली हैप्पी. सो जब हम लोग आए तो हमने जो फर्स्ट टाइम करा
स्कैन के लिए आए. फर्स्ट स्कैन के लिए आए तो जैसे नॉर्मली हम स्कैन के लिए आए तो हम डॉक्टर पॉलदीप के पास गए, तो उन्होंने जैसे ही स्कैन करने लगे तभी हमें पता चला भी हाँ ट्विंस प्रेगनेंसी है. तो जैसे उन्होंने स्कैन किया तो हमें कॉम्प्लिकेशंस के बारे में बताया भी ये कॉम्प्लिकेशंस है ट्विंस प्रेगनेंसी में. तो उन्होंने फिर हम डॉक्टर के पास गए, डॉक्टर रेनू के पास. फिर उन्होंने हमें समझाया, उन्होंने बताया भी अभी देखते हैं करते हैं, क्योंकि जोन से कॉम्प्लिकेशंस थे अगर उसको देख के अगर देखा जाए तो कोई भी ये प्रेगनेंसी फ्यूचर में आगे नहीं कंटिन्यू नहीं करता. तो डॉक्टर्स नॉर्मली सजेस्ट करते हैं कि ये कंटिन्यू होगा, बट डॉक्टर रेनू ने हमें सजेस्ट किया कि आप थोड़ा टाइम देखो फिर आगे देखते हैं क्या होता है.
इवन जब मुझे पता चला मैं तो पहले 10 मिनट हंसता ही रहा कि ट्विंस है. तो दैट वाज नॉट एक्सपेक्टेड. मैं 10-15 मिनट तक बाहर अकेला खड़ा हंसता रहा. तो लोग देख रहे थे हंस क्यों रहा है, बट इट वाज वेरी न्यू थिंग टू अस. And we never, in our entire family history, we don't know any twin babies. And even I think these are the first kids, twin babies in our entire village as well. So that was very very new to us. But उसके साथ जो complications थी वो भी पता चला, and doctor explained us well. उसके बाद we also went for another opinion as well. We went to Delhi and we had a opinion, and the suggestions were same as said by Dr. Renu. So we were confident that we are going in the right direction. Whatever doctor is saying, she knew, and we were also we are going in the right direction. It's all on us now what decision we have to take, because it was all about whether we want to continue the pregnancy or not, or whether we want to drop these kids, because it's a very complicated thing. But internally we were very confident that we will pull it out, there will be no issues, and we were very hoping that everything will go fine, and we take a decision कि हम लोग इसको continue करेंगे, हम इसको drop नहीं करेंगे. And the big support in making that decision was from Dr. Renu, because she motivated us that if we have a belief that it can happen, if we will not have a belief then nothing will be possible. So that belief help us to take that decision. That was really very brave decision, I would say, because it's this continuing this pregnancy is also not financially that easy, frankly speaking, as a parent and as a spender. So overall we took that decision. We went for multiple ultrasound in the process. There was a time when we were going हर दूसरे दिन हमें ultrasound के लिए जाना पड़ता था. तो बट वी मैनेज समहाउ. देयर वाज टफ टाइम्स, हमें मैनेज बहुत करना मुश्किल भी था, बट समहाउ वी मैनेज इट, एंड भगवान की दया से सब कुछ सही गया, कोई इशू भी नहीं आया. हर बार यही होता था कि एक वीक निकल जाए, एक वीक और निकल जाए, and slowly we touched 32 weeks. And after that, as suggested by doctor, we went for the delivery. I also want to highlight the kind of facility which New Gurgaon needs was available in this hospital. The kind of infrastructure build up is good, and that was very helpful as well, because every parent want that wherever they go for they are going to spend, the infrastructure quality should be good, and the quality of doctor should be good, the team should be good. So that support was there, and we came in here, and the baby got delivered. After that only we came to know about Dr. Updesh and Dr. Rahul. So from there we came to know other problems which were associated because बच्चे प्री टर्म थे, 32 वीक्स के थे, तो उनको हमें पहले CPAP में रखना पड़ा. ये सारे टर्म्स यहीं पे आके सीखे हैं, CPAP, वेंटिलेटर और SpO2 कितना रखना है, और NICU क्या होता है, NICU की फुल फॉर्म क्या होती है. So it was all learning, but overall our babies were in the hospital for more than 30 days, more than a month. I would say it was a good journey. We had a good support from Dr. Rahul, Dr. Updesh, and the entire nursing staff as well. Sister, I think Shiva she's like Dadi of these kids. So overall we have a very good experience, and we were also supportive, I would say, and the entire staff was also supportive to us, and we haven't faced any challenge in terms of anything. Overall we are going with very happy feelings, good feelings, and I would like to appreciate the entire Aarvy team for this, and thank you very much for giving us these two beautiful kids. Thank you.
Thank you so much.
Congratulations.
Thank you.
Long
Thank you
life.
very much.
Let me give it to you. Congratulations. Many congratulations. I'm so glad. Shiva, डाल दो बेटा सबको. Dance. Yeah. So Prabjot came to us with the twin pregnancies, and after a few initial ultrasounds, we came to know that the kids were not growing normally, and there was some discordance in the growth. And one of the baby was a little lesser in weight, and the other baby was gaining weight a little more than normal. So this type of pregnancy is not very common. They are seen somewhere around 2 to 3 pregnancies in a 1,000 cases approximately. So as the pregnancy progresses, the discordance increases, and usually the baby which is smaller in size is not able to survive. So we had to watch very closely as far as the growth was concerned, and there were some serial color Doppler tests were done. Initially they were done in a gap of 7 days, and later on when we had to take a decision of the reduction of the second child, we had to do it every alternate day also. And finally we were able to somehow push the pregnancy till 32 weeks because of these tests, because we had a very good sonologist, and who was able to tell us that the gap was there, but yes, the gap was not increasing at a very high pace. So somehow we were able to pull it off till 32 weeks. After 32 weeks we terminated the pregnancy, and the delivery was cesarean section. And babies were handed over to the able neonatologists.
We had two babies, 32 weeker. One was 1.1 kg and another was 1.7 kg. So there was a difference of almost 30% weight between the two, which is defined as severe discordance. So in these babies, there's a risk with prematurity. There comes a risk of respiratory complications right at birth, which were noted in both the babies. They were both having respiratory distress syndrome and had to be given surfactant. They required respiratory support for first 4 to 5 days. Gradually we were able to start feeds and progress. as per the tolerance of the babies. Such babies are also prone to complications such as jaundice, lowering BP, infections. So all these problems are more common in these babies compared to term babies. Discordance in the weight, there were more severe problems expected in the smaller twin. For these two babies, we were able to discharge the bigger twin in 3 weeks. The second twin had a slightly more complicated course. Baby had increased incidence of respiratory cessation on day 10 of life and had to be ventilated for a couple of days. At that time, we felt the baby may not survive, but we tried our best, and fortunately with our active intervention, we were able to get the baby out of the ventilator soon. Again, the process started. We again started feeds. After that, it was a smooth ride. So the next, after next 14 days, baby did pretty well, and yeah, we were able to discharge the second twin also after 5 weeks. So babies who have a birth weight of less than 1.5 kg need tertiary level NICU care, which Aarvy has. These babies require intensive monitoring right from the birth, because these babies are, like I said, they're more prone to stop breathing, they're more prone to have lower BP, higher risk of complications. So they need intensive minute-to-minute monitoring. Also, feeding is also a problem. So like term babies, we can directly start on mother's feed. In these babies, we have to start first on tube feeding, then gradually we have to progress to katori and spoon feeding. Only around the time of discharge are we able to shift these babies to breastfeeding. So all these complications are more common in preterm compared to